All right, we're here with Adam today, and Adam's a patient here in our office. You came in a couple weeks ago with pretty severe low back pain. It was about a 7 out of 10, and it was about 2 or 3 treatments. We got you out of pain, but you work as a delivery driver. You have to use your body a lot for work, and you kind of tweaked it this past weekend. And the pain came back a little bit. Is that correct?
A little bit, but right now it's non-existent right now. So
okay, great. So he's just in for a tune-up. He felt a little sore over the weekend after we got the pain down in 2 or 3 treatments, and we're gonna fix him up again and send him on his way. Let's take a look. Can you bring both feet up here on the table? Good. And scoot down just a little bit. So we're gonna focus in on his thoracolumbar junction. It's the part of the spine where the mid-back transitions into the low back, and this is a very common area to get muscle tightness, spasms, and joint dysfunctions in the vertebrae. So we're going to cross both arms here, come on underneath, we're going to straighten both legs here. Good. And cross here and here. Good. And good. Going to feel exactly where some of the pain is coming from. We're going to go all the way back, relax back. Good. Very good. Great. And let's see, now we're gonna focus on your lumbars. Can you lay on your side here? Face me. Cross here. Gonna bend this top leg here. Just relax your shoulders. So I'm gonna come in, palpate his lumbar spine, see where the areas of dysfunction are. Good. Can feel right in here. The L5 vertebrae. Good. Very good. And let's go on the other side. Straighten this bottom leg here. Good. Cross these arms here. Scoot over just a little bit. The shoulders back. Same thing here. Very good. And let's see, let's go face up. Now Adam also has very tight leg muscles, which is contributing to his low back pain. So we teach our patients how to stretch their muscles, work on their core strengthening, and we give a whole body approach here in the office. Any back pain with this?
Nope.
And bend the knee just a little bit. Good. And you've been pretty much back to work with very minimal pain after you came in 2 weeks ago?
Yeah, exactly.
And you've actually been a fan of our YouTube channel? You've watched some of the videos?
I have, yeah.
You were thinking a couple weeks ago you may have to take some time off of work because the pain was so bad.
Yeah, exactly, yeah. But thankfully I'm good now.
Great.
So do you think I do stretch every night, but before work, but do you think like, I don't know, stretching more throughout the day would not make my hamstrings so tight?
Absolutely.
Yeah.
It's like anything else. It takes, you have to work on it, and it takes repetition.
Yeah.
But I can tell you've been working on them. They feel looser than a couple weeks ago.
Okay.
All right, let's come on up and walk around a little bit, see how your back feels.
It feels great. Yeah.
Good.
Yeah, it feels great. No pain.
Good.
Okay.
There you have it, folks. Severe back pain resolved in 4 office visits. He's happy, we're happy. This is Dr. Jeffrey Gerdes, Carolina ChiroCare and Rehab, your Raleigh, North Carolina chiropractor. Thanks for watching.
First came in to see Dr. Gerdes, my pain was on a scale of 7 out of 10. Within 3 or 4 treatments, my pain was gone and I was back on the job. The staff was really friendly and helpful, and after my pain was gone, I didn't feel any pressure to come back.